Welcome everyone to our Mixed Methods webinar. I'm going to introduce Timothy Gutterman, who's giving our presentation this morning. Timothy is an applied research methodologist and an associate professor at Creighton University in Omaha, Nebraska. His research interests, scholarship, and teaching are in research methodology, namely general research design and mixed methods research. Tim's grant-funded empirical research uses quantitative, qualitative, and mixed methods research to investigate the use of technology in health, education, and assessment. He also conducts research on teaching, learning, and developing research methods capacity in his role as an evaluator and faculty for the NIH-funded Mixed Methods Research Training Program for the Health Sciences. He co-authored with John W. Creswell Educational Research, Planning, Conducting, and Evaluating Qualitative and Quantitative Research, 6th edition. Timothy, welcome. And if you'd like to take control of the screen, I'll just make one more mention, Timothy, for all of our new attendees. We'll be taking questions from Timothy approximately 45 minutes into the presentation, and it's going to be limited just to that chat window for today. So if you're concerned about your microphone, don't be today. We're going to be limiting things to the chat window. Okay, I'll hand it over to you, Timothy.
Thanks, and thanks to you, Juliana, to MMIRA, and to IIQM for hosting this and having me here today. Thanks to everyone for joining. So I want to spend some time talking about joint displays and really what those are. So I want to talk about joint displays. I'm not saying it's the only method to integrate in mixed methods research, so just to be very clear and upfront about that. But I do think it's one potential very useful strategy to break down the process of integration and to ensure that we're really achieving that in a meaningful way. I'll talk then a little bit about selecting a joint display based on our overarching mixed methods design and how we intend to integrate our qualitative and quantitative research. Within that, I'm going to show exemplar joint displays, and we'll talk through those a little bit, in addition to some templates that you might be able to use as a starting point to create your own joint displays. So why joint displays? Why are we talking about this? We've had this increasing emphasis on integration. Perhaps it's not increasing, but it's always been there, but we're continuing to recognize and really stress the importance of integration as a centerpiece of mixed methods research. In fact, it really defines and distinguishes mixed methods from other types of research methodologies. And integration, which is really at the core of mixed methods, is this process by which we're bringing qualitative and quantitative approaches together in a meaningful way. And that can happen in a few different ways that I do want to talk about as well. One of the issues that's been now levied on published mixed methods literature, we see this going back probably over 15 years worth of published literature looking at mixed method studies that have been conducted, is that integration continues to be underutilized. And I would argue that if we're not integrating in a mixed method study, we're not really taking full advantage of mixed methods and what it has the potential to offer. So I'm going to point you to a reference that I'm sort of loosely following as I'm talking here today. And it's a paper that's published in the Annals of Family Medicine on integrating quantitative and qualitative results through joint displays. Now, for those of you from different disciplinary backgrounds, don't be daunted by this article. It's really using health sciences examples, but we tried to write it in a way that it's broadly applicable to multiple disciplines. And I work across multiple disciplines myself and work with people across multiple disciplines. And I think you could find this to be helpful if you want to take a look at this for some further reading. So to delve into a joint display and provide kind of a formal definition. It's bringing together quantitative and qualitative research or data or results together through visual means. So through a joint display, though, we're trying to draw out some new insight. So there's synergy. There's something more that happens by integrating the two forms of research than had we really kept the two separate. And joint displays are a way to make that explicit, I think. I also think that joint displays give us a framework, really, a framework to integrate. I think it breaks down this cognitively difficult process of integration and thinking about integration. Of course, it's a way to represent mixed methods analysis. We see more and more of these in published papers. If you look at some recent empirical studies in the Journal of Mixed Methods Research, you'll see many excellent examples of joint displays. But the process of developing these is really important. I think it's important to think about integration. And just drawing from the paper that I'm basing this on, we looked at examples in health sciences and found that application of joint displays and integration in general was lacking. But I think that probably extends to other fields as well. I just don't want to make that claim because I haven't conducted that study yet anyway. So to give a little bit of foundation, which is going to be necessary as we talk about joint displays, I want to emphasize this process of integration and what integration is. So keep in mind that it's a distinguishing factor of mixed methods where we're intentionally collecting both quantitative and qualitative data, but we're bringing the two together in order to address our research questions. And integration is really generating something new. So it could be starting quantitatively and then using that to generate qualitative follow-up studies. In another example, we could perhaps start qualitatively and use that to generate instruments or adapted instruments based on those initial findings. Integration could also generate meta-inferences. And meta-inferences are new inferences that result from integrating results or data from quantitative and qualitative research. So by combining the two, we're learning something more, essentially. I think this idea of generating something new, whether it be follow-up studies, instruments, other quantitative features, or meta-inferences, these are examples of that synergy that happens from integration, and it allows us to arrive at something that we wouldn't have been able to arrive at or learn had we kept the two forms of research separate. So integration at the methods level, which is going to be my focus, is how one brings together quantitative and qualitative results or methods in a mixed method study. And I want to talk about these three different types: merging, connecting, and building, and then link these different procedures or strategies for integration to joint displays that we might be able to create. So in merging integration, we're bringing qualitative and quantitative data, could also be results, together for analysis and comparison. So for example, a study published in 2015 by Gutterman, she used a joint display and compared quantitative pain scores of individuals who were receiving either music therapy or music medicine to help with their cancer pain with their qualitatively derived experiences. So what their experiences were like with those interventions, for instance. But this idea of merging is the idea that we're comparing the results from both databases. So this diagram that we have here is commonly called a convergent mixed methods design if you're following the work of Cresswell and Plano-Clark. So we have quantitative data collection analysis and qualitative data collection analysis. We're bringing the results together to compare, perhaps relate one to the other, and then we're making interpretations based on that. So we're generating meta-inferences based on those comparisons or relationships between the two. So connecting integration, we might think of our goal as explaining, perhaps. So in connecting, by definition, and definition is that article I mentioned earlier by Fetters, Curry, and Cresswell, we're linking data through sampling. So by that, I mean that based on the results of one form of data, and typically it's based on the results of quantitative data, we are going to pick a purposeful qualitative sample for a follow-up. So we see this often in this diagram we see here at the bottom, and I'm going to try to point to this, where we have phase one, which is a quantitative phase, and we're trying to explain those quantitative results in more detail by planning this qualitative follow-up phase. So this is an explanatory sequential mixed method study. And then of course we're making an interpretation at the end. An example that we'll see a little bit later is by Finley and colleagues, quantitatively analyzing and then conducting qualitative interviews to validate a scale. So to validate those initial quantitative results. Building integration, the third integration strategy that I'll talk about, is when the results of one component are informing the data collection of the other component. So this we most often see in an exploratory sequential mixed methods design, and that's what we have at the bottom here. And I apologize this cuts off a little bit, but it'll be cleaned up in the slides that we send out a little bit later. I'll make sure that it looks better. So in phase one of an exploratory sequential study, we have qualitative data collection analysis, and then it's based on those results right here, we're building into something quantitative. So phase two might be quantitative instrument development. It could be adapting an instrument, identifying variables, and then we generally have a continuing quantitative phase as well, where we're perhaps testing that instrument. So this phase two is sometimes thought of as more of an intermediate step. So an example of this was a study by Hagerty and colleagues, 2012, beginning qualitatively and then using that to develop a measure of continuity of care. So what about more complicated or complex mixed method studies? If we are perhaps doing a mixed methods intervention or a multi-stage evaluation or a social justice lens we have operating. Well, merging, connecting, and building still form the basis of those. And in many cases, you'll be using multiple types of integration within those types of designs. So keep that in mind as we're continuing and talking more about joint displays. I'll show pointed examples from those three common designs, but keep in mind it's okay. You can have more than one joint display in a mixed method study and more than one way to integrate in a mixed method study. So joint displays then give us a way to represent integration. As I've said, bringing results together through visual means, drawing out new insights, giving us a framework, and we see these continuing to develop. So how might you present integration in your research projects using joint displays? In this table right here, and I won't walk through this in a lot of detail, but I want to instead show you examples of these types of joint displays, breaking them down by types of mixed methods designs we're using. So for a convergent design, I'll talk briefly about side-by-side displays, statistics by themes, geocoding joint displays. For explanatory sequential designs, I'll talk about participant selection, interview displays, interview question displays, and also I'll show you a little bit of how we can use a joint display to explain results at the end of the study. And then finally, for exploratory sequential designs, how we could use joint displays to represent instrument development in a systematic way. So for convergent designs, we are often talking about merging and representing merging in a joint display. So a basic template that I want to share for a side-by-side joint display appears here on this slide. And I give full permission to adapt these and change them and fit them to your own studies. That's the goal here. But the way this template is organized for you to work with and for you to fill out is that I have on the left side qualitative, and I've just labeled that interview findings. It could be focus group findings, whatever type of data you're working with. It could be grounded theory findings, case study. Again, you can adapt this. And then in the column next to this, I have quantitative, let me get back to my pointer, quantitative, and I've labeled it survey results. And then note I have this column over on the far right for a mixed methods interpretation. So you can organize this in different ways. It could be organized by qualitative themes. Perhaps you have a conceptual or theoretical model as well that you could organize that by. But then in each of the cells, so in the qualitative interview findings column, we might write something like a descriptive summary of our findings. We could have things like codes in addition to some illustrative quotes. So qualitative codes in addition to some illustrative quotes. In this quantitative column then, in these cells, it could be a summary of results related to the theme. It could be a statistical copy if we have that to share. And then in the interpretation, and this is what's really important, this is where we're discussing what we learn by integrating. So we might summarize things like meta inferences, whether our quantitative and qualitative converged, agreed with one another, or disagreed with one another, or this idea of expansion. And expansion might be that we've simply learned more fine-grained details by including a qualitative component that we didn't have in our existing measures. This column right here, though, in my opinion, is very important. We don't see them in many joint displays, and that's okay. Sometimes it might be discussed in narrative and prose while writing about the joint display, but I just want to stress the importance of really providing those mixed methods interpretations that you're making here. So I want to now show you an example from the published literature of that type of joint display. So this is a study by Panda in 2015, appeared in, I believe, the Journal of Mixed Methods Research, looking at stigma related to HIV in West Bengal. Data collection included quantitative stigma measures at the community level, and then narratives, actually, narrative stories of discrimination. So integration was merging. In this side-by-side joint display that we see. So note, this joint display is really kind of interesting. So they have it organized by these different domains, and they note that they're juxtaposing their findings from their qualitative and quantitative investigation. So their domains, things like fear, blame and judgment, shame, and then they aligned, and this is facilitating that merging comparison, what they learned quantitatively about fear. So myths about HIV transmission, acts reflecting fear, impinging on rights, and so on, along with some more specific examples here, right next to results from what they called their quantitative investigation. So keep in mind that we're just looking at this top row, this domain of fear. They presented what they learned qualitatively right side by side with what they learned quantitatively. So 76% of results in one region versus another reportedly, versus 59% another reportedly had fear of transmission through non-invasive contact. So this is more of a narrative way to write about the results of their quantitative study, but the idea is still the same. So here they're showing those two results together. And then in the example, or in the actual narrative in this article, they discuss more about their integrated results and what they learned by comparing those two. So if you're interested in merging using joint displays, here are a few different steps that I recommend. First, analyze quantitative and qualitative results separately, and separately could mean iterative, that we're sometimes going back and forth between what we're learning quantitatively and qualitatively. We are then summarizing those results, so what we've learned from our quantitative and our qualitative components. Step 2, create a joint display where we're linking, and this is a typo, it should say qualitative themes to related quantitative constructs. So the idea is that we're comparing on similar concepts, if you will. So for a certain qualitative theme, what's a related quantitative construct or item on a survey or component? And then we're comparing those results. And then in our interpretation, we're interpreting and developing inferences, and we write a discussion of that. We write a narrative about that. So Another way to think about merging would be to relate your statistics by themes. And this is a statistics by theme joint display template. So here, it's organized a little bit differently in that what I've shown in this example is arraying different levels of a quantitative variable against qualitative themes. So different levels of a quantitative variable could be something like high, medium, and low scores on a test or an instrument or looking at performance levels. And then the themes could be presenting illustrative quotes in addition to statistical results by theme. So again, it's helping to really facilitate some of that comparison. So moving on to an example from the published literature, this was a study conducted by Whitting, Park, and Gallo looking at how older adults and their physicians talk about depression status. Data sources included semi-structured interviews with older adults who, and this is important to remember as I look at this joint display, self-identified as depressed. So all of these older adults said that they were depressed. And they collected, in addition to that, quantitative demographic information and instruments, things like depression measures and so on. So integration involved then merging those themes with statistics and using joint displays. So here's a joint display that at this point is 10 years old. I think it was definitely ahead of its time when it is published. But this is just rotated a little bit differently from the template that I showed you. But here they have it arrayed by qualitative themes. So my doctor just picked it up. I'm a good patient. They'll just check out your heart and things. They'll just send you to a psychiatrist. So each of those are mutually exclusive, qualitatively derived themes. And I think of this as really more of a topology. So these are types of patients, types of older adults. So they've grouped into these 4 different categories. And then they have, for each of these distinct mutually exclusive groups, quantitative results. So just looking at these first 2 columns, my doctor just picked it up, and I'm a good patient. And keep in mind, I'm showing you just a joint display. There's an entire article around this study. But they describe I'm a good patient is older adults who sort of didn't want to bother their provider. They didn't want to be a burden. They just sort of wanted to go along with things. My doctor just picked it up. These are people who were just a little bit more in sync or seemed to be more in sync with their physician. They picked it up right away. So looking at some of these quantitative results then, for my doctor just picked it up, and I won't go through all of these, but the mean age, 73.3. For this next column, 77.5. Depression score, the CESD, 19.0 for my doctor just picked it up, to 11.9 for I'm a good patient. Not very concerning, actually. And then if we jump all the way down to the second to last row, for this first group, 100% of the physicians rated the patient as depressed. For this next group, I'm a good patient, 38% rated the patient as depressed. So keep in mind, all of these older adults said they were depressed. So as they discuss in this article, this really illustrates the value of integration. So without combining these 2 forms of data, they wouldn't have learned that, for example, for an older adult who presents as a good patient, they don't really want to bother their provider. Even though their depression score is lower, it's perhaps particularly important to probe on depression status because as is, only 38% of these older adults were rated as depressed by their physician. So that means that those individuals would be going unidentified, untreated, for instance. And they talk about that in this paper. And they talk about really why it was so important and why they wouldn't have arrived at some of these implications and inferences had they not integrated the 2 forms of data. So another example of merging would be really trying to relate geocoding by themes in a joint display. So in this example template right here, I've tried to draw this as a map, so it looks like a big rectangle, but let's just pretend this is a map of a region or an area. Let's call it a state or a province. Within each of these, then, I have different regions that have been identified, so these can follow borders, of course. And then you can use different techniques to present data by region. So we can use things like color coding, as you see in this example, to indicate maybe levels of a categorical variable. So let's say high, middle, and lower scores on a certain measure. We could overlay themes, illustrative quotes. We could overlay other information like percentages in these. So let me now show you an example from the published literature. And this is from a substance abuse needs assessment conducted in the state of Wyoming in the US by Allison Minu and colleagues. They collected data from qualitative interviews, a quantitative alcohol problem severity index score, and then a quantitative perception of problem score. Integration then happened by merging those qualitative findings with the quantitative data by geographical area, and that yielded this very interesting joint display. So this joint display, this outline, is the state of Wyoming in the US. Each of these areas are regions within Wyoming. So what she used is color coding to represent that alcohol problem severity index. So these darker red regions have a greater problem. The lighter colored regions, like we see over here, have less of a problem. She then used different size circles to overlay that perception of alcohol problem index. So, for example, we can see in this county right here, it's dark red, so we have a big problem. There is this big circle, so there's also a large perception of problem. And then in here we have things like denial, family, leaders, motivation, permissive. Those are all qualitatively derived themes. So she's overlaying qualitative results, again, by region. In addition to, you'll see around the edges, some illustrative quotes. So the bars don't understand how to serve alcohol responsibly. So keep in mind, this is an excerpt from a much larger report, but it communicates so much information, which is what I think is powerful about this joint display, for instance, and why it's definitely one of my favorites. So think of a policymaker or disseminating this information to an audience. Remember, the goal was needs assessment of substance use. So you could look at this county right here and see there's a large problem, a large perception of problem. We have indicators of themes that are arising there. And comparing that to the county next door, even though there's a larger perception of problem, in reality, the problem severity index was low. It was at the lowest level, in fact. So in terms of figuring out what to do next, where to target resources, it makes it a little easier to perhaps decide where to first intervene, and then also give some indicators, again, grounded in the views of the residents who live there, what might be a good place to start and target that. So moving on then to an explanatory sequential design in representing connecting in a joint display. So first we might think about a participant selection joint display. So the idea here is that we want to be systematic as far as how we're using our initial quantitative results to plan that qualitative follow-up study, and in particular, how we're using that to determine who we want to talk to or who we want to sample. So in this template, what I've tried to do is organize it in some kind of fashion by the quantitative results, because again, that comes first. So based on that, we might have, and it could be key results. So it might be from a different significance test that we've conducted, some other kind of statistical testing. It could be by domain. It could be levels of a categorical variable, high versus low, for instance. But the idea is that based on these different results, we want to then describe our sample and who we really want to talk to probe those results in further detail. We could even organize it by different characteristics. So it could be something like gender, region where someone lives, race, ethnicity, education level. Those are all examples of characteristics. And then within these cells, we can describe that sample, for instance. So again, it's using those initial results in a systematic way to plan what happens next. So another way to think about really being planful is this sort of template for an interview question joint display. So based on quantitative results, and similar as before, we can organize this by key results, by scales, by constructs, but based on whatever it is we want to explain, what are specific questions that we could ask? So here's a time where we could write actual questions that we're going to use on an interview protocol, a focus group protocol, observational protocol, whatever the case might be. But by doing this, we're being systematic so that we're really trying to explain and expand on the results that we really want to focus on. So that's why I encourage this type of joint display. The organization is intentional. So this is following an explanatory sequential design where we start quantitatively and then plan that qualitative follow-up. So that's why I have the quantitative results on the left side and the qualitative interview questions on the right side. So let me show you a couple of examples, one from the published literature by Ivankova and colleagues, trying to understand students' persistence, which is retention in an educational program, through collecting web-based surveys, qualitative case study with follow-up interviews and document analysis to explain those quantitative results in more detail. So this is an excellent example of an explanatory sequential study. I would encourage you to read it if you want to look for a good example. But in particular, I want to show you this table that she used to show participant selection. So this is organized by 4 quantitatively distinct groups. So those who are beginning in the program, matriculated, graduated, withdrawn, inactive. And as we see in the table title here, they're trying to relate the participants selected for follow-up case studies using a maximal variation principle. So maximal variation is a type of qualitative purposeful sampling where we're looking for and intentionally looking for differences in our sample. So she wanted individuals who varied in terms of age, gender, residency. So for in the US, for instance, whether if you're attending a public school in particular, public university, whether you're an in-state or out-of-state student can make a very large difference in terms of your tuition, the amount of money you pay. Family status also was something that they apparently sought variation on. So within each of these, then, for each group, she presents some details, some of these characteristics, age, gender, residency, family status, about each of these cases that were selected. And again, it's being systematic about that selection. So let me give you one other example, and this is sort of at the end of an explanatory sequential study. Well, we want to really showcase that variation and explain variation. So here we have this column for quantitative results, another column for qualitative findings. We might have some supporting quotes as well, and then a column for a mixed methods inference. So this looks very similar to the side-by-side joint display that we talked about earlier. So I won't explain this in a little bit more detail, but as far as what you could have in these columns, it could be results of analysis, perhaps significance values, things like scores on an instrument. Let me just show you an example to make it a little bit more concrete though. And this is the study I talked about briefly earlier by Finley and colleagues, validating a measure of relationships, and it was work relationships within clinics. So quantitative data included this work relationship scale score, qualitative interviews to understand variation in scores, and then integration using those qualitative results to explain variation. And in this case, it was variation that was expected, that you would want to find, which provided evidence that this instrument was really detecting differences that they wanted to detect. So this is just an excerpt from a larger joint display, but notice a few really important characteristics of this joint display. So for one, this is organized by a conceptual model. You might think of a theoretical model as well. In this case, it's Lanham's relationship characteristics. And that's what each of these are. So rich communication, hateful interrelating, and then it continues on in the other pages. Right below it is a summary of the qualitative findings. So in terms of rich communication, they learn communication through face-to-face conversation, most effective when messages are unclear and ambiguous. And then we have low versus high scoring clinics. This is actually just dichotomized quantitative results. So this is quantitative, even though it doesn't necessarily look like it. So in terms of rich communication, what they did is showed for a lower scoring clinic in terms of rich communication versus a higher scoring clinic in terms of rich communication, what's an illustrative quote that shows that variation. So within each of these, they do have an illustrative quote. So I think that some days we should just sit down and say, okay, this is what's going on. The higher scoring clinic talked about a huddle every morning and so on. But this might be an example you would look at if you have an explanatory sequential study and are thinking about a joint display. So for exploratory sequential designs, we think of representing building integration in a joint display. And here's just a basic template to think about building integration. So what's really important in building and in exploratory sequential studies for instrument development is that we're using those qualitative findings in a systematic way to inform the instrument, whether we're developing one from scratch or we're adapting one to ensure that it's culturally relevant for our setting. But if we're not taking advantage of those findings, we're really not taking advantage of mixed methods. So here, I start with this big column of qualitative findings. And again, this is just really showing the flow of procedures that happens in this design. So on the right side, I have this column for my quantitative instrument. This is organized by themes. You could organize it in different ways. It could be by a conceptual model, for instance. But what I'm trying to show here is that for a qualitative finding, we have a certain theme. We might have some codes, qualitative codes related to that theme. And then what is an actual scale or section on an instrument or survey that we can derive from that theme? And what are specific items that we can write as related to those codes? So let me show you an example from an instrument development study. And this is from my work on research capacity building. So it began with this qualitative exploration, including qualitative interviews and document analysis, and then developing and testing an instrument. So in this joint display, I'm trying to illustrate how we actually used qualitative findings, and our goal was to develop an instrument to assess research skills, but how we use those qualitative findings systematically to write items on this instrument. So here there was a theme, and this is abbreviated for the purpose of joint display, about experiences. So that became a section, a scale on the instrument called professional experiences. Another qualitative theme was related to researcher characteristics, so we labeled that personal characteristics on the survey. And then I have qualitative codes, and mapped to each of these codes are specific items that I wrote based on that. It doesn't have to be one-to-one. So in fact, note here for some of these items, like reading mixed methods literature, for some of these codes, there's actually multiple items that relate to that. So reading mixed methods literature was a code, and that became 2 items. I've read a mixed methods book. I read mixed methods literature at least weekly. But the idea is to be systematic. And keep in mind, you don't have to have an item for every single code. If it's not relevant to what you're trying to do, then you can leave it off, and that's completely okay as well. As an alternative here, we could have also listed specific quotes, qualitative quotes, and then shown how that influenced item language, so how we actually wrote items so that it really reflects the language of our target participants. So just in brief, an example from a more complex design, and this is from an intervention mixed methods design. I'll show you an example from a grant that we mentioned in the introduction that I work on, using virtual human technology for education, and specifically to provide training in communication skills. So data sources in the joint display that I'm about to show you, we had things like quantitative program scores, an attitudinal scale, and that was included in this joint display. Also some exams with standardized, they're called standardized patient instructors. Then we had qualitative observations and written reflection. So I want to show you merging quantitative attitudinal scale results with qualitative written reflections in this side-by-side joint display. And this is published, so you can refer to the paper. Lead author is Dr. Crone here. It came out in Patient Education and Counseling a couple of years ago. This is organized by domains. In this case, it was qualitatively derived domains about verbal communication, nonverbal communication, engagement of the training. We then have these two kind of big columns, one for the intervention group, and because it was a randomized controlled trial, one for the control group as well. And then finally, a column with the mixed methods inference, this interpretation of findings. So within each of these then, for the intervention and the control, we have both quantitative results in addition to qualitative results in the form of illustrative quotes. So in terms of verbal communication, our attitudinal score from this survey, mean was 4.11 for the intervention versus 2.77 for the control group. In the paper, we note that was statistically significant. And then some illustrative quotes that really provide evidence of this difference. So how to introduce myself without making assumptions about cultural background in the intervention group. The control group, this example is talking about mnemonic devices. So in the interpretation here, and this shows an example of that mixed methods interpretation. So we wrote, intervention arm comment suggested a deeper understanding of content than teaching using memorization, and mnemonics is in the control, a difference confirmed by higher attitudinal scores. So again, it's noting whether they agreed or disagreed, and that's what you see here by the difference confirmed, but then also discussing really what it was we learned by combining the two forms. And in this case, by combining the two forms and then also looking at the difference between the intervention and the control group. So in terms of constructing a joint display, just a few more comments before we open it up. Keep in mind that building a joint display is an iterative process. I've presented templates, and then I presented the endpoint from published papers. For every joint display I've been involved with, I can assure you that what you see published was not what we started with. And it really helped us, though, to integrate by starting to build these joint displays, making revisions, revising it, and that led to the end product. So don't be afraid to edit and revise. After linking your data, so thinking about parallel ideas or concepts that you could link, think about integration and what type of design. And I would strongly encourage you to mock up a potential joint display, something like these templates, really early on, even when designing a proposal in the early stages of a mixed methods research study. Of course, I think they're important, again, in terms of dissemination, but I think it helps to keep the end product in mind by starting by creating one of these joint displays. So a checklist, some things to remember, a clear title to indicate what's presented, ensure that it includes or somehow brings through both quantitative and qualitative data. Of course, it could be aggregated results, identifying what those sources are, demonstrating the integration consistent with your design, stage of integration, type of integration, And then you can write about this. So a joint display can become a way to organize your prose. So you create a joint display and then write a paragraph discussing your integration and integrated results. And finally, you might think about parallel levels of aggregation. So a theme is sort of a broader level, for instance, kind of like a statistic or a p-value. So just be wary of criticism that might arise if you're trying to compare quotes, which is really more raw data, with, say, a statistic, for instance. And then finally, I leave you with a few readings. There's an excellent new book by Pat Baisley on integrating analyses and mixed methods. She mentions joint displays, but talks about integration far more broadly and comprehensively. Our papers on using joint displays, and then another excellent chapter by Dr. Plano-Clark and Dr. Sanders on the use of joint displays as well. So at this point, I would love to take some questions or comments.
Hi, Timothy. Can everyone hear me?
I can.
Okay, looks like it. Okay, good. So Timothy, while you were giving your presentation, we did have a few questions that came in, and I'm just going to read those out. From Hoda Kane, can I start with quantitative that might help me check predictors or to check pre-perceptions? Then I start my quasi-experimental, then I end with qualitative to supplement treatment results and administer the post-instrument that I used before my intervention. And what do we call such design? I know it's a mixed quasi-experimental with a question mark at the end. Coda, please just if you can type into the chat window if I've captured that.
Yeah, that seems reasonable. It's just important to have a rationale as far as your phases and, how you're using those quantitative results to check predictors and so on, and then ending with that qualitative to try to understand or supplement or whatever. As long as you have a rationale, that's fine. I would probably call this more of a mixed methods intervention design. That would probably be the term that I would use for that. You might call it a multi-phase study, but to me it sounds like your overall intent is related to the intervention, related to testing and intervention. So I might use that term.
Thank you, Timothy. And from Na Yang, he was asking about, he said he would, or they would appreciate a few MMR interpretation examples. Na Yang, do you feel like that was covered in the presentation after your question, or Timothy, can you offer a couple more?
Sure. So I would look at this full example right here where we give some interpretations by domain, comparing, in this case, was an intervention and control, qualitative and quantitative results. But it can be something in terms of noting whether the two forms confirmed, disconfirmed, whether it expanded, so you're sort of learning more details by combining the two forms. Those are good places to start in terms of that. Generally, though, you still don't see a lot of interpretations included in joint displays. You kind of have to dig into, usually it's either results or sometimes a discussion section to see those examples. But the idea is that you're writing about, this is really what we learn by bringing the two forms of data together. So by looking at our themes in light of higher versus lower performing organizations. This is what we learned in terms of what distinguishes those. So those might be examples of writing more interpretations.
Thank you so much, Timothy. Another question from Tammy. How do you bring all of these research elements together when creating a research program, followed by assuming an exploratory concurrent design? Do we summarize based on phases?
Yeah, I think so. I think an exploratory and then convergent design. I'm trying to think of what that would look like. I'm guessing you're combining both of those elements in more of a larger multi-phase study, which is fine. I would definitely summarize by phase, but what I would do is start off with something more like the overarching design. And I strongly recommend, and a lot of my colleagues recommend, let me see if I can get to an example, actually drawing out procedural diagrams to make that clear for the reader. So I apologize as I'm scrolling through the slides to find what I want to find. But a procedural diagram is something kind of like this, or kind of like this here at the bottom, where you have laid out by phases what you're doing. And of course, you can be more detailed in here. So rather than quantitative data collection analysis, you might say, maybe it's the results of a randomized controlled trial or survey study or whatever the case is. So you can be more descriptive in terms of these labels. But in terms of laying out the whole plan, I would probably start with a figure, drawing out a diagram like this, describe that briefly, and then I would go into details in a proposal for each phase. So I think you said exploratory, so I would start out by saying, phase one is qualitative, and then within that phase, discussing pertinent details. So probably your participants, your data collection, your analysis, any kind of validation strategies, and so on.
Thank you so much, Timothy. Another question from B. Stern. What would mean scores or ranges of scores be parallel with quotes in a joint display?
Good question. I don't think it would be parallel with quotes, but I think you could include quotes. So I would say that mean scores would be more parallel with a finding. So think about a theme or maybe a sub-theme. And then it's okay to include, in my opinion, it's okay to include an illustrative quote as well. But I would at least include more of that aggregated theme or sub-theme level.
Wonderful. Thank you so much. And we've had a couple of questions that relate to, research funding, one from Tammy and one from Joanne. So I'll read those out. I would like to apply from Tammy. I would like to apply for research funding, and I'm not sure how to proceed. Do we take a phased approach or by using a project-by-project approach? And then from Joanne, would you show some examples of how to use joint displays in grant proposals without data and without sacrificing too much space? I'm not sure how much. Yeah, so a couple of funding questions there, Timothy.
Yeah, sure. As far as, project by project or phased, I think it kind of comes back to what's the scope of your study, and is that consistent with whatever funding proposal you're looking for. I rarely see proposals that are criticized because they're trying to do too little. Often the scope is too large, and the feedback is to continue to narrow. So if you have in whatever call for funding you're looking for, if it's well resourced and you think you can do it, then yeah, it might be okay to just discuss all phases of the effort, and you might even conclude with something like, the results of the study would lead to, and maybe it's scalability in a follow-up study or more testing or whatever the case is. If you don't think that it's adequately resourced, then it's okay to break it into chunks and perhaps just apply for a piece of it as well. So it's kind of hard to give advice without knowing more details about your study or what you're doing. I'd be happy to respond to an email, though, if you want to follow up.
So, and I'll just
In
note that
terms
in
of
any of these
including
questions,
joint
there is the opportunity. Sorry, go ahead, Timothy.
No, go ahead.
I was just going to mention any questions because we're starting to get close to time and we've got a few more questions that have rolled in. If we hit 10 a.m. Mountain Daylight, there is an opportunity. I will forward on the questions to you, Timothy, and maybe we can have a chance to do a summary document along with the PDF for any outstanding questions. Okay. So that second question on funding was how would you show some examples of how to use joint displays in grant proposals without data and without sacrificing too much space, with a thank you there as well.
Yeah, it depends on how much space you have to work with. They're all different. Some grant proposals are 6 pages, some are 25. You could perhaps do something like this that I have, where it's maybe a template for a joint display. If you don't have the room for that, I've also noted myself and seen lots of people note that they will use joint displays to do things like juxtaposing interview and survey results together on common aspects of a conceptual model or whatever the case is. There is kind of I don't know if they call it a joint display necessarily, but a different table that you might look at we call it an implementation matrix, and that's more where you're walking through phase by phase of your research, quantitative, qualitative, and mixed, and giving a little bit more detail in terms of what the data sources are, how you might analyze it, and then really, what's the end goal of that phase. So what's perhaps the outcome of integration? And I'm happy to share some of my own examples from that. And those can be really helpful to include in grants because I think it reduces some of the complexity of mixed methods.
Thank you, Timothy. And I have one question from a new person. Simnar asks, I've already collected quantitative data about funding of government programs in the regions and have conducted surveys, collected qualitative data. Could you explain to me how I could illustrate the real efficiency of the government programs by using joint display?
Well, I think, what I would probably start with is thinking about what are related concepts in your quantitative and qualitative data. So if you have some themes that you've identified, and then you have some related survey items that you could go to, or I guess not survey items, but data that you've collected about, this funding to really look at that in conjunction, I might do that. If you're trying to show things like efficiency, you might just look at it from that lens, or it could be efficiency and effectiveness, for instance. So what did you learn qualitatively about how efficient things are, but then also perhaps what did you learn in terms of the time it takes for a decision? I'm just thinking of broad efficiency measures, or of the number of applications, how many are funded, and so forth. So trying to look at some related concepts to really portray that larger result.
Wonderful. Thanks, Timothy. And one more circle back from Hoda. She's asking for a little bit of clarification. Can I assume that I have two designs? Survey design, since I use the survey as a pre-post in addition to checking predictors, while the second is quasi-experimental, or just call it mixed method quasi-experimental design?
If you're using, if you're integrating the two forms of data, then I would call it a mixed methods design. And it's okay if you started quantitatively and that's informing a mixed or a subsequent quantitative phase. But if within there you're collecting both forms of data and you're integrating the two, I would probably call it a mixed methods design.
Wonderful. Timothy, thank you so much for this presentations, and there's a number of thank yous that have rolled in on our chat window. I want to take this opportunity to thank everyone for attending today. I'd also like to thank again MMIRA for their support of these webinar series. Our next webinar is coming up on September 25th. This is Lorraine Cook and Vimala Kamalodine. It's an Introduction to Mixed Methods case study research, and it'll be at 1 p.m. Mountain Daylight Time. So hopefully we'll see some of you back then. Timothy, again, thank you so much on behalf of everyone here at IIQM.
Thank you.
Thanks, Timothy. Okay, bye everyone.